With more people now eligible to be vaccinated against coronavirus, some are finding it easier to just cut the lines and cheat the system to get their shots before they're allowed. Good evening, everyone. We thank you for joining us tonight at 6. I'm Colleen Marshall.
Carrie Charles. With those vaccines in high demand, NBC4's Jamie Ostroff looked into loopholes allowing people to get an appointment even if they don't qualify. Jamie confirmed that people are gaming the system. She also spoke with some health officials about why those loopholes exist. She joins us now. Jamie.
And I'm going to say right off the bat, Carrie, this is a tough story to tell. We don't want this to be an invitation to do anything unethical. But the fact is, I confirmed on the record and on background that this is happening. People are lying about having a qualifying job or a health condition to get a vaccine appointment, and there's little that can be done about it. This is a recording from an Ohio State University student's computer screen. Jack Long zips through the vaccine scheduling form on Ohio State University Wexner Medical Center's patient portal, which any patient or OSU student can access. He stops just short of clicking schedule. Long doesn't qualify for the vaccine yet. He doesn't want to take a coveted time slot from someone who does.
We were shocked that it could be that you could schedule it and that you could essentially lie.
Long did some digging and published his findings in the Lantern. That's OSU's student news outlet, where Long serves as managing digital editor.
Have you identified any students that were able to get an appointment by doing this?
Yeah, so that's actually how we heard about it. So we heard that some students had done it. We verified that they were able to make those appointments. The one thing is that we have not yet been able to do is verify that they've gotten their vaccines.
Turns out there isn't much some providers can do to stop ineligible people from getting vaccinated. An OSU Wexner Medical Center spokesperson said this is not just their issue, but a statewide issue. She showed me this guidance from the Ohio Department of Health. The state of Ohio is not requiring any additional documentation for proof of eligibility. However, providers may develop their own screening and monitoring procedures to evaluate eligibility. Putting those procedures in place isn't necessarily easy or ethical, says Columbus Public Health Commissioner Dr. Mashika Roberts.
Asking someone to have verification of their medical condition specifically will present a huge barrier to many in our population.
Particularly, she said, minority and low-income populations who don't have consistent or reliable access to a doctor. There's no way to know how many people are trying to exploit the system, but Dr. Roberts knows it's happened.
Some individuals have tried to say they work in a school and qualify for K through 12, and we've identified some of those and been able to remove them from getting a vaccine.
A spokesperson for The Ohio State University called it disappointing and unacceptable that anyone would misrepresent themselves to get a COVID vaccine before it's their turn. I also followed up with ODH, which said the eligibility guidelines are there for a reason and that lying to get around them might deprive someone at greater risk of getting sick from COVID of getting that life-saving shot. Local for you, Jamie Ostroff, NBC4.